So, welcome, Amy, to the Naked Eye podcast. I'm really excited for this opportunity to explore some of your specialties and what you help people with, and maybe where there's some overlaps with some of my listeners and how they can help continue to find some more awareness and healing in their eyes and their body in general. Really excited to cover some topics around breathing and, well, the abbreviations of the PABR Institute, the pain, the awareness, the breathing, the relief, and that all sounds good to me. So I'm excited to unpack this with you today and welcome you to the show.
Thank you so much for having me, Nathan. I'm Dr. Amy Novotny. Just to tell you a little bit about me, I started out getting my doctorate in physical therapy, but I actually transitioned away from that when I realized there was more to our body than kind of some of the principles taught in physical therapy. I was really excited about learning this process of changing our internal wiring, getting our bodies out of fight or flight mode, and the amazing benefits of that. I mean, it's phenomenal how much we can get out of pain, how we can get out of surgeries, how we can calm our stresses and calm our anxiety, which I know really works in conjunction with your type of work where you're trying to get people to improve their vision from a holistic point of view. And you are allowing them to change their nervous system and to calm themselves down so their eyesight improves. And so this is a great conjunction and a great way to introduce some other concepts that could possibly help some of your listeners.
Yeah, absolutely. And did you get into this work, for some of your own personal reasons before you started, wanting to actually see if you could help some others with it too?
Yeah, well, actually, it kind of happened by chance. I was training for marathons. I was actually trying to qualify for the Boston Marathon. And at the time, I was running on the treadmill 8 miles 3 times a week on the treadmill. I was also going through a lot of stress. My mom was dying of cancer, and a lot of things were changing in my life. And so I was taking some coursework through the Postural Restoration Institute, looking at asymmetries in our body, and there's asymmetries in our diaphragm. And so that actually matters. When you realize that things are not the same side to side, especially in the diaphragm, we need to look at, okay, how do we maximize and use the diaphragm differently to help us, get air in, get air out, and to really change how we feel. And so at the time, then I just started playing with my breathing. And the key was I started playing with my rib cage position while I was on the treadmill. And all of a sudden, I felt this calm come over me. And it was as if, the coyote and the roadrunner's running and its legs are moving and its body's just still. It's exactly how I felt. My whole trunk was just calm. And it was my arms and legs were moving under me and without me being stressed, and all the tightness that usually comes with running fast, the aches and pains that come from, running long distance, all those runner issues, boom, went away. It was as if someone had flipped a light switch, and now all of a sudden I saw this light, and it's like my body just responded, and it really started out that way. And as I was going through this process and playing with my breathing and realizing I was calming down that fight or flight nervous system response, all of a sudden I got faster. I didn't have pain. My mobility, my flexibility all restored. And I could run marathons faster. I dropped 7 minutes off my next marathon time, blew through the qualifying marks. Next marathon, a couple months later, dropped another 7 minutes without changing one single thing other than the way I breathe. And so, of course, that put me on a mission. Okay, I need to start helping other people. I need to start trying this out on people. I need to develop a process to this. What is it that really got me to be pain-free? And it helped me with the stress of losing my mom, the anxiety that developed. So there's all of these reasons that it kind of came together into this technique I call the PABR method.
Nice. And like I mentioned before, these standing for pain, awareness, breathing, relief. It sounds like definitely a very holistic kind of approach in terms of not just working with the physical stuff, but also dealing with some of the emotional and psychological stress as well.
Yeah.
I love that link there with the breath, how it can have that sort of physical component, but then it can also totally change our whole mental, emotional state too.
Absolutely. And we don't realize that when you think about you're going through your daily life, think about all the stressors that you have. Driving to work, getting there on time, just work in itself can be stressful depending on what you're doing. Financial obligations, we have all different types of relationship, kids, partners, parents, boss relationships, coworker relationships, all of these things. Now we have the pandemic. There are just so many different things that increase our stress level. All those little tiny stressors can be very additive. And what happens then is our body starts to change in response to it. And we often don't realize it. Muscles contract without our awareness. Yeah. And if you think of it this way, if you pick up a bucket of water and you're telling your bicep muscles in your upper arm to work to lift up that bucket of water, now you have control over that. If all of a sudden you hear a gunshot go off, your body is going to tense and jump all over the place. You now had a response to a fight or flight stressor. Your muscles tightened up everywhere. If you put that bucket of water down and stop using that bicep muscle, you can tell your body to do that. But all that other stress tone that came from that gunshot, it's still there. Because we often don't realize that happens, and then we don't know what to do about it. And our body habituates, and now that's our new level of normal. So we have to look at, okay, how do we change out of that? How do we get ourselves to release that and let go? Because it affects your eyeballs too. It affects everything. I worked with a gentleman today who had a nerve condition in his face. It's related to that. There's all these different reasons why our stress levels really impact our physical body and our ability to function and perform. So it's all tied together.
Yeah, I'm glad you brought the eyes into it, because that's kind of where I went to it in terms of those little stressors you were mentioning of that's kind of one of the concepts from Dr. Bates with the Bates method is all of these things that we do with our eyes every day can build up eye strain if we leave it unchecked. And we might not know it or might not feel it, and then we get to the end of the day and it's all built up and pent up, and we have the eye strain and the blur and the dryness, and we don't get the relief from that. But sounds like what you're talking about is finding ways to kind of maybe notice when that does come up, and maybe some strategies of how to kind of let it go and release it, so that we don't end up all pent up like that. We have strategies to maybe kind of dissipate some of that, because it's not that one thing that I say is that, like, the Bates method doesn't just transport us into this alternate reality where we never feel the stress again. It's going to come, but what do we do with it, and how do we work with it to have it not change our baseline? Like you said, I love that analogy you used with the water bucket of like, okay, now this is kind of the new normal, and this is where I just hang out and I'm used to. I also love what I'm hearing, because some people, listening might feel like they've already got, busy schedules, or, they might not have time to add in some extra thing. But like you shared in your story, like it's something that you were playing with while doing other things like running or our daily tasks that we need to be doing, because the breath is happening during it anyway, just like our vision is happening during it as well. So we've just got these opportunities to kind of play with it during the activity, which could be kind of a time saver too.
Absolutely. And that's the thing, is a lot of times luckily I was able to develop this while running, but when people are just learning how to change everything about their body, we start sitting or lying down because it is such a drastic change from what they're used to. Things like chest out, shoulders back, sit up, suck your gut, and go into a perfect posture. I tell people to do the exact opposite of that. Because when you do that and you pull your shoulder blades back or your shoulders back and you suck up your gut and stick out your chest, you're actually kicking in that fight or flight nervous system. So your body is going to habituate to all these muscles tightening up. And a lot of people don't realize the impact of that and how detrimental that can be, because we're not supposed to be in fight or flight mode all day long. We're supposed to be in parasympathetic relaxation, and then we kick into fight or flight mode when we need to act. So if I'm doing a long distance run I want to stay in as low of fight or flight mode as possible. Granted, I'm running and I'm moving, so I need some energy to do that, but I want to keep myself as calm as possible. So that way, when I need to, I can sprint across the finish line, or I can use every excess reserve in my body to make it the 26.2 miles or 100 miles or whatever I'm doing. But what we don't realize, though, is if we're in that fight or flight state, so as I mentioned, that bucket, and you feel that tension all over your body, if I habituate to that, now my body's already bumped up a level. So the next time I get a stressor, my body is going to be more reactive. I have less reserves of calm to allow me to handle that new stressor. And so often people just keep moving higher and higher up that sympathetic chain, and they get this threshold. And then they wake up the next day and they have pain or a stress attack or anxiety attack or panic attack or chronic fatigue syndrome, that they have bumped up a level too high. Then they can't fall back down, or they'll come down a little bit but bounce back up. And then everything becomes a trigger. The water spills on a table and it's just water, it's going to dry up, but that becomes a huge disaster. Or, someone didn't turn on a turning signal and they turned right in front of you. And then all of a sudden you start cussing them out and screaming at them. Those are triggers. But we don't have to, but ideally we'd like to calm ourselves down so things like that don't become a trigger for our whole entire body and we have this visceral reaction. We would like it, okay, the water spilled. Okay, I need to get some towels, paper towels, whatever, and wipe it up. It's not going to be a disaster and it shouldn't affect the rest of my day. But if I'm already hyped up, my brain neurochemistry is set for hyped up, everything is going to be a disaster. But the powerful thing is you can change this. It's not your personality. It's not how you were born. It's often how your body state is put and how you are breathing that have changed the way you respond and react to things.
Yeah, I think it's important to reiterate that a lot of this stuff is kind of learned behavior or sort of, conditioned just because of, like you pointed out, those everyday stresses and just the world we live in. I mean, it's sometimes the cards are stacked against us to maintain that calm and that peace and stillness. But I think it's amazing that we can explore these tools to get closer to that point. And I'm kind of curious how, you mentioned this connection with your ribs earlier. And a lot of times when people think about the breath or the breathing, they go to the lungs or the diaphragm and don't really maybe think as much about the role of the ribs. And I wonder if there's anything on that you wanted to share or demonstrate or kind of maybe how you used to do it compared to, the newer ways that you do it now.
Mm-hmm. Sure. So I'll kind of go through what people often do now. So if we think about taking a breath in, we typically see someone either lift their head, their shoulders, their chest, or stick out their belly. All of that is a result of accessory muscles breathing for us. I often see the lower ribs lift up. So if anyone who's listening now, if they take a breath in, can they feel their lower ribs in front lift up? If you put your hands on your lower ribs, can you feel those ribs lift up as you initiate your breathing in? Most people do. We want them to stay down instead, but that's hard because often that rib cage is so elevated on most people that they lift up the ribs to get air in, which creates a negative space for air to go into the lungs. It's not how we want to do it because that kicks in our fight or flight nervous system. Because if our chest is out and our lower ribs are flared up, now you're setting your body in fight or flight state and you're just going to lift and it's going to stay that way. Now, if we want to, we can shift to using our diaphragm, and that's not belly breathing. There's this misconception out there that belly breathing is diaphragmatic breathing, and I'm going to challenge you on that because we want the use of our diaphragm means we're getting air into our lungs, not air into our belly. I do not want to push out my belly to try to get air into my lungs. One, that's distending your abdominal areas, and we don't want that. But what we do want is the diaphragm to work. And the way that diaphragm works is through support of the diaphragm walls. So the diaphragm is this dome on top of some walls. The dome part drops down and flattens when you inhale, which creates a negative space for air to draw into the lungs. Then when you exhale, that dome goes back up. Now, in order for that dome to flatten, the walls of the diaphragm have to be a nice, stable support. It's like that fortress, it needs that support to hold the roof. Or if the roof is flattening, it needs to still hold the roof or hold the flattened dome. The problem is the side of the diaphragm, those walls get their support from your front of your ribs being down and your side abs helping to hold them down. So if I am sticking my chest out, sucking my gut up and in, and my ribs flare up in front, guess what? I'm not supporting the diaphragm walls because my ribs are lifting up in front. And that's what I need to support the diaphragm down in order to have that strong dome contraction to stimulate the vagus nerve to calm me down. But if I'm doing that Superman posture, military posture, chest out, shoulders back, suck up that gut, I'm going to have to breathe using these accessory muscles that tell my body I'm in fight or flight mode. And so true diaphragmatic breathing, we want those front lower ribs, we want the whole rib cage to drop down and the front lower ribs to stay anchored down because they support the walls so the dome can flatten to generate negative pressure for air to go in. And so it seems backwards, but what I talk to people about is we have to change the way you hold your rib cage and the pattern of your breathing. So when you breathe in, ideally you want to breathe in your nose to your throat and then feel this suction of air going in, not lifting up your ribs, not pushing out your belly, not pushing out your chest. We want the ribs to stay down. And then hold that position for a second. Then when you blow out, we let the chest drop in, ribs drop down, belly comes out, which most people are used to. When they blow out, they suck the belly in. Guess what? As soon as you suck the belly in, your ribs lift up, you're going to be in fight or flight mode. We want the ribs to drop down. So that means that belly has to come out, okay, which goes against what a lot of people are used to. A lot, but does wonders.
Yeah. And so just to clarify, when you say ribs go up, because I know you said sometimes we can do this sitting where we're upright or lying down where we're kind of supine.
Yes.
So is it sort of like ribs going like up towards the sky or kind of like going out, or is it kind of like a combination of both, sort of like diagonal?
Yeah. So a lot of people, if they have their hands on their lower ribs, kind of that diagonal part of their lowest ribs, most people will lift them up and out. So they lift it up towards their head and out towards a person in front of them. And so what that does is when you breathe and lift through there, most often you are using your back muscles to help lift up your ribs or to tilt your ribs. Again, when the back muscles contract, they're going to pinch on that fight or flight nervous system that lies along the spine.
Yeah.
Further putting you into fight or flight mode, further causing muscles to tighten throughout your body, further keeping you in stress, anxiety, abnormal muscle use that you're not even aware of and you can't even feel.
Since maybe those accessory muscles you mentioned, the back, the ribs, these different areas, maybe since they're kind of more superficial in terms of like actually maybe closer to the surface, or like the diaphragm is so like deep in there, maybe people have a little bit less feeling or connection there at first, especially if we're kind of used to just using these other muscles to do it. It's kind of lost some of that function in a way.
Yeah. And so basically what happens is our body gets used to something. We are creatures of habit. So our nervous system rewires. If you think about a little kid, like a toddler, their bellies are out, the ribs are down. They are roly-poly. If you look at any toddler, their belly's out. They're cute as can be, and they can tumble, they can move because they haven't started listening to us adults who tell us, suck your chest, suck your belly in, throw your chest out, pull those shoulders back, sit up straight as possible. And I have to tell you, the kids that listen, those are the ones I see who are in chronic pain or having trouble. It's not the kids who didn't listen to their parents. It's the ones who are high achievers, who are getting straight A's, who are doing some kind of sport. They're the ones that I see who are having the most pain and stress, anxiety, and often can have surgeries. It's because we start to change the neuromuscular wiring because of this idea that It's beautiful to have our chest out, shoulders back, suck up our gut. But we take it to the extreme. We take our rib cage out of neutral. And I'm not saying I want you to walk around completely hunched over. I'm saying I want your rib cage in the position it was designed, as a cage or cylinder, not tilted back on your back. I want your rib cage in neutral so that your back relaxes. So when you walk, you can feel your legs move. When you reach, you can feel your arms move instead of tightening up every part of your trunk to try to reach forward or to pick up something or to run or to do whatever it is. But we have to work on the training of the muscles and how that nervous system works, just like you do with eyesight. I can't tell you how many people's faces, their muscles are so tight because they have learned to keep everything in their body rigid, because so many practitioners and fitness professionals say, let's tighten everything up. Let's make everything strong. Have that strong core. Let me tell you, a strong core doesn't mean tighten everything up. A strong core means, is your rib cage in position? And can you bend, twist, and move in a stable way that provides you strength, power, but also flexibility? Now that's a stable core. And it still allows movement in your arms, legs, facial muscles, all of that.
Yeah, I think that's a critical point there of this combination of like you said in your marathon story about for the most part of the run, you want to kind of be in that more calm state so that when you need that extra fuel reserve or that sprint, like you can tap into that. So it's this like balance of the power and the relaxation and how they, because I think for me, I used to sort of think they were mutually exclusive. Like you were saying, so like the trainer is saying like, all of this activity requires this, tightness, strength, force. But, when I learned the Bates method and learned this whole dynamic relaxation concept where, a lot of athletes use it because it's kind of being in that flow state or being in the zone, or sounds kind of what you're describing of being very active and being very high performing, but not straining or unnecessarily tensing or squeezing things where that would be just kind of wasting the energy or kind of draining it unnecessarily.
Yeah, absolutely. And even going alongside that with the whole energy thing, when you think about energy, if we're in fight or flight mode, our body ramps up, and it takes so much energy to keep ourselves that way, which distracts from our ability to focus. It distracts from our attention. It distracts from our ability to perform. And so it becomes a huge problem over time. And so often you'll see high-level entrepreneurs, business owners, they're exhausted. They try meditation, they try different things, they'll go get a massage. Their body is at its limits because they have no more reserves left. They're in fight or flight mode, and that they've nothing left to give because their energy goes so much to keeping them in that fight or flight mode. And they don't know how to reel it back in, to let go, to free themselves up.
You're right. A lot of times we hear kind of opposing instructions, or whether it's in a yoga class or somewhere. I mean, I remember though being in it was a Qigong class, and it was it was one of the first times I had been introduced to that kind of opposite way, kind of like you described today, of going to yoga classes. It was always breathe in, fill your belly like a balloon, or like the Buddha belly or something like that, and then exhale and let it kind of contract and sink back down. But in this Qigong class, they told us to do the opposite. They said, on the inhale, I want, like you said, the exhale, you can actually let the belly come out. And then the inhale, maybe the belly comes in a little bit. And it felt so strange at first because I think I had gone from, pre-yoga, I was very just upper chest, shoulder breather, shallow breaths and stuff like that. And then the yoga helped me kind of connect in with the diaphragm and try that version. And then trying to reverse that around was another kind of threw me for a loop. But in light of the fact that part of the way that you came to this is through your own experimentation and playing around with your body, that I think that's kind of what I did as well is finding, where does it feel like it's actually helping me and actually supporting me, as opposed to actually, this feels more like just an exercise that isn't really showing up in these benefits that you described earlier. So that could be an indication of like, is this the right way that I'm meant to breathe, or should I try something differently?
Yeah.
Now, do you find
Absolutely.
that this type of breath kind of becomes more automatic, or like it sort of takes over as just the way the system does it after you kind of practice it in a certain way?
Yeah, so it does take some time, because obviously the way we breathe is a habit that we've developed.
Yeah.
And so it does take some time. If we start working on it, I say little bits of time, 5 minutes here, 5 minutes there, 5 minutes there, you start to feel a change. And when you feel your body calm down, you feel yourself regain some energy, you feel yourself being able to rest so that you can perform at a higher level, then your body starts to crave that. It wants to be in that state. And what's more powerful is then when you need to perform at that high level and you need to kick it into high gear, you can, because you have the ability to do that, because your body isn't so taxed on being in fight or flight state all the time. So it's little tiny practices. And then as you get better at it, your body just starts to shift and it starts to change. Now, depending on the person, one of the reasons I work one-on-one with clients virtually throughout the world is because there are sometimes people have layers and layers of compensations on top of each other, and it just takes some time shifting the body back into a neutral state. And often it does take someone like me or another person to help them recognize what are the steps to do that. But for tons of people, I have so many free resources out there about getting started in this type of breathing. For so many people, just doing those free resources can get them very far in their journey.
I resonate with that because that's always been kind of one of my missions, is not only to coach people one-on-one and really give people that kind of higher level individualized guidance and help along the process, but I also wanted to just put a bunch of free stuff out there and let people try it out for themselves and really see, does this resonate with me? Does this make sense to me? And because the beautiful thing about breath and vision is that, it's free, like we're breathing all the time, we're seeing all the time. And there are ways we could figure this out on our own. But yeah, I mean, I got so much help from my vision coach, and, it was definitely a game changer when I had that help there. Awesome. And it sounds simple at first, but yeah, it's amazing how complex it can get once you start to peel away some of those layers, like you said.
Absolutely. And what's neat is the best part of this is you're gaining control over your life. You're gaining control over your state and how you feel. You don't have to rely on other people as much. And it's a holistic approach. So next time you get some pain, a lot of people will say, oh my gosh, I have pain. Either I'm going to ignore it or I need to go see someone. What instead, you have another option. Say, you know what? I know what to do. I can change my body position and how I breathe to get rid of this pain. And I can do it within a few minutes. Because think about it, when a pain crops up, anxiety and fear crops up because you're like, wait, I don't know. How did that happen? What'd I do? Oh my gosh. Is it going to go away? How do I get it to go away? But instead, if you pause and say, okay, this pain is a message from my body to my brain that my body is out of position. Mm-hmm. Now, I need to know what to do about that. And sometimes it can be a quick fix. Sometimes it takes longer and there's more to do in a process to get it out. But if we change the way we view pain and think of it as a messenger, boy, does that open up a whole new world and a lot of control. And that's truly what we seek is our health. We want to have some control over it. We want to have the ability to make decisions and see the benefits of those decisions.
I had the pleasure of interviewing Bill Paravano, who's known as the knee pain guru, a couple episodes ago. And we were talking about pain and similar concept of pain being information was really a big takeaway for me about that conversation, and that link between the vision and the blur too, because the blur, if you have blurry vision, to quote you, that's your body or your system telling you that something is out of alignment, or out of position, or whether it's the spine. Some of these vision problems could be posture related if the nervous system is not functioning freely, and or it might be more kind of mental, emotional stress. But the pain and the blur, I think, both get a bad rap in terms of like they're these bad, evil things that we're trying to avoid all the time and get rid of. And if we actually face it and look at it as a messenger or as some feedback, then we can learn how to not necessarily, buddy up with it or become best friends, but just appreciate that you're getting that signal and seeing, oh, maybe I can test something else out and try something differently.
Yeah, absolutely. And it's amazing. Our bodies are this piece of art. If you think about how resilient we are, our bodies want to heal. They want to feel good. Sometimes we just need to meet the right person to help us change our bodies and to guide us and educate us on how we can choose to feel better, how we can change an aspect of our body in a natural way without medications, without surgery that cuts us open and creates space. I often talk to people about orthopedic surgeries, joint replacements, knee replacements, hip replacements, back surgery for a disc herniation or a rotator cuff repair. Often what's happening is we have to create space because tissues are pinching together. And so a surgery will go in there, create space. A rotator cuff repair is a little bit different, but sometimes there's impingement and they go in there and do some cleanup. But if you think about it, if we can change the way the muscles are working and change our body position, if the muscles no longer contract all the time, but learn how to relax, that allows the bones to go back into a neutral position. It allows them then to contract when they need to, relax when they need to, on bones that are in the correct position. And all of a sudden you regain that space. But if you do surgery, and sometimes people want surgery, I totally understand, everyone's different and that they have their preferences. With surgery, you're cutting open space to create the ability for a joint to move freely. The problem is the nervous system input into the muscles doesn't change. So you often see with joint replacements, with back surgeries or neck surgeries, they often have to have another surgery soon after that, within a couple of years, another back surgery, another neck surgery, another hip replacement or knee replacement, because the nervous system hasn't changed. The muscles haven't changed the way that they were contracting. And so they continue to pull abnormally and decrease space somewhere else. But we can change that. Even if you've had a surgery, we can still work on changing the nervous system so you don't have to have another one. And this is how hip knee replacements, bone on bone, injections and medications. I have a lady, several people, but one that really stands out. She's a doctorate in psychology and nursing. And she was doing injections and medications for years. Bone on bone, told that she had to have surgery. This was back in 2016. She came to see me. 2 weeks later, she canceled her surgery, no pain. There was no reason for her to have the surgery. She can now travel all over the world, climbing in and out of zodiacs, hiking trails. She's in her 70s, mid 70s. And she didn't have to have surgery. She hasn't had one more injection, she hasn't had one more pill. And she's been doing this. In 2016, she had been doing that for years. And all she did was learn how to calm her nervous system down, change the way she was holding her body to allow herself to go back into neutral. And of course, she changed her breathing too. And she uses that. And she hasn't had to have that life-altering surgery where you're dealing with metal in your body. It's really incredible what we can do with ourselves if we just learn this process. And I say that in, one of the goals that I have is trying to get this out there on so many different platforms. because if we can avoid unnecessary surgeries and medications and shots, believe me, the world would be a better place.
Yeah, I'm glad you shared that. I appreciate that, because that was one thing I was going to ask, is if you have any particular stories or people that you worked with who really stand out, who've been able to really notice some big changes in their life, and so that's really, really inspiring.
Yeah. I mean, I've so many. He's a sportscaster in Dallas, a 7-time Emmy winning sportscaster for football. So he's on all the time talking about the Dallas Cowboys, and he couldn't sleep. He was having trouble sleeping, and he went through this, and he can now sleep 8 hours a night. He uses this process to calm him down in between sportscasts. He goes off into a room, he grabs a straw, and he starts blowing. And, think about it. He's in high level stress position. He has to be on, and he has to be energetic. But again, he hit a tipping point. And so he had to learn how to calm himself down. I mean, we all need it from all walks of life. I have a lady who worked at a post office for 30 some years, never missed a day of life. She came in to see me, and she just, one of her knuckles in her hand hurt, and it's bone on bone. They told her, you're going to have it replaced. And she was told that she needed to have dexterity exercises with her hands to strengthen her hand. I said, we can do that. I can show you, but that's not going to get rid of the pain. Do you want to get rid of it? And she said, I'll do whatever it takes. I don't want to miss any day of work. If I have to have surgery, I'm going to miss work. So I said, okay, we're going to teach you how to breathe. We're going to get you to relax that shoulder. And within one visit, her pain went away. She didn't have to have the surgery. She didn't lose her goal of working every single day and not missing it. It's just, there's little things. I mean, story upon story of people, and this works virtually. Gentleman just recently, gentleman out of a hip replacement, two different ladies out of neck and shoulder surgeries that, they were told they have to have these surgeries. I mean, just even abdominal issues, anxiety, and the stories go on, all because these people calmed down that fight or flight nervous system and learned how to control it themselves. I didn't touch them. I just taught them, and it was up to them to do the work.
Yeah, I love that, because I know, like the woman with her knuckle. I mean, sometimes, or any kind of thing, sometimes we kind of are trained to think we need to go to somebody to fix us, or get fixed by X, Y, and Z. And I love that you just insinuated that you're really helping people realize that gift is really found within, and it helps to have a little bit of guidance to kind of hold that mirror up and kind of reflect it back on yourself. But yeah, that's beautiful. Do you work with people who have like any kind of forms of arthritis and things like that as well? I would imagine that.
Yeah, absolutely. I mean, that's a big thing, is people will get a diagnosis, or they go in and see a doctor, they have pain. Then they get the diagnosis, oh, you have arthritis, that's the cause of your pain. And I say, nope. Nope, I don't buy that. And so I say, okay, we know you have pain, and we know there is arthritis, which means your cartilage has degenerated. And you might have a bone spur in there, you might have space decrease. But what we really have is something about your joint is off position. So we have to calm down that nervous system so the muscles free up, so they stop pulling abnormally on that joint. So the joint releases, you get your mobility back. So arthritis, I mean, all those joint replacements, those were all arthritis. I have people in neck surgeries. I have a very high TV executive who was told her neck was degenerated. She couldn't have, didn't have feeling in her left arm and hand, and it was going numb. She was dropping things. She was scheduled for a major neck surgery, cut her open, fuse things together, create some space. And I said, is one of your goals not surgery? She said, no. One of my goals is to get the surgery as quickly as possible and get out of pain. And I said, what if I told you you could possibly avoid surgery, but it's going to take some work on your part? And this was degenerative. I mean, she had all the signs and symptoms of arthritis. Guess what? Within a month, she canceled that surgery. And that was back in 2017. So I really challenge people. We love to place labels on ourselves. I mean, it's great. We love all these scans. They tell us, okay, you have that bone is touching that one. You have that bone spur. You have fluid in there. I think they're fascinating too, but it doesn't limit me or label me in terms of this is my end result. All it does is tell me the state of my body at that point. Other than that, it doesn't even mean that's the cause of my pain. It just tells me there's fluid there, or there's a disc there that doesn't have as much fluid in it than the other, or there's a bone spur. That's all it tells me. It doesn't tell me that's the cause of my pain. It doesn't tell me that that's means I can't lift up a bucket of water again. That is all determined by your nervous system, your fight or flight mode. And we can change that as long as you're breathing and you can think and process. And I say that in a very gentle way when I say think, because there are times where I've worked with people with dementia and it takes a lot longer because there's a lot of repetition to get them to change.
Right.
They still can change. But I say you need to be able to think because you need to be able to process what I'm saying and be able to feel. And that's how you hold on to it. So, but anything's possible.
Yeah, I mean, it's been really interesting ever since you gave a few instructions earlier. I've been doing it and just kind of letting my belly sort of release and kind of expand as I'm exhaling to kind of create that space for the ribs to go down. And then when I inhale, I'm really allowing those lower ribs to kind of stay in position and not lift up. Mm-hmm. And it's been interesting to notice how I kind of come in and out between these times of like, kind of like you were just saying, like really processing what you're saying and really, really super focused. And other times it's like, I get distracted almost with the movement but I'm right back with you. And it's like, that to me, I think is one of the challenges with not just the breath, but with these vision habits too, because I'm helping people become more aware of looking away from their screen more, or, blinking more frequently, or, taking these little breaks and shifting and these little things that can require a little bit of extra mental energy to kind of keep track of. And at first, it might distract you from the email you're writing or that thing you need to do, but over time, it just really gets all infused and baked in, and you don't really even have to think about it anymore. I love how you said earlier how your body starts to crave the feeling that you get from doing the right thing. And the eyes do that too. They really crave that distance focus when you've been on the screen for 1 or 2 minutes.
Right.
And that did not used to be the case for me. My eyes, I was keeping them imprisoned on the screen, just like staring at it for so long. And, but yeah, I appreciate how you're really letting people know the fact that it can take some time, it can take some work, and it can take some falling back into the old habits and noticing like, oops, I'm out of it and now I can come back. And I think each time we come back, it really kind of like brings us that one step closer to it eventually becoming just really sustainable and sort of unconscious almost.
Yeah, absolutely. Yep. I completely understand everything you're saying.
Yeah. And it's, I got to say, it is very relaxing. And I'm noticing that, I'm 6'3", so I've definitely struggled in the past with posture things and just like having to kind of be looking down at stuff a lot. And that actually is sort of a relief to feel like, oh, it's okay to let my ribs kind of like go down to allow, you're right. There's been this thing planted in my mind that like, that Superman pose you said earlier, like I've got to stand up straight, shoulders back, and it might be from a combination of my yoga training or just being a human and being told that from all different places. So I'm really excited personally to play with this stuff. And I heard you mention a straw earlier. I'm curious because for Christmas this year, I got a bunch of people these stress straws, little necklace that you like exhale through to kind of help you draw out the exhale to make it longer. Is that kind of similar to what you were referring to?
No, I just use like a regular straw. Yeah. Nothing special, just a regular straw. There's a lot of different breathing devices out there. I'm a little bit hesitant on them because they often create pressure for you. So there's ones that are pursed together or whistles, and they create a lot of pressure that then goes inside you. I like a regular paper or plastic straw and just chop it in half. So it's about 4 inches long. And you put it in your mouth. And when you blow out, it's an open airway. You are letting air out, and so the pressure is not building up in your chest, but you can also feel the ribs drop down. Some of these ones that are kind of like a whistle, but they're pinched and then you blow out into them and they create pressure. What that does is you tighten up when you do that. And often we're already tightened up. And so it takes you in the other direction. So I'm very, very careful. I say, hey, plastic and paper straws cost pennies. Yeah. Why not use one of those that you actually could have already in your cabinet?
Yeah. Then you can have them in every room.
Yes, exactly. Yeah. So
that's cool. Definitely, like when you were talking about achieving this new different way of breathing and running, feeling like the road runner, where your upper body, your core was kind of stable but your legs were moving. It kind of reminded me of some of the experiences I've had with Alexander Technique. My Alexander Technique teacher would help me kind of get into just be walking around, and she would sort of and it was a lot of rib adjustments, actually, now that I think about it, like kind of helping the ribs come into the correct place. And then all of a sudden it's like my legs were doing their own thing. And I was just so much just like, it's hard to describe, but it's, yeah, well, once again, it was the combination of the alignment, the body position, and the breath awareness that can really pretty quickly bring you into this different kind of state, which I assume is probably that parasympathetic state, feeling that kicking in and really feeling like, wow, something's changing right now. The first time we hear something like that, it might almost come off as like too simple or too good to be true, but it's worth exploring to see if you can actually create a physiological shift within, seconds or minutes or hours or whatever, just being experimental with the body mechanics.
Absolutely. And I mean, what you're saying is spot on. I'm not familiar with all the different techniques out there. So, and I imagine there's probably some out there in this world that there's a lot of overlap from what I do. And I'm grateful for that, because the more we can get people to shift into parasympathetic relaxation mode, the happier this world will be.
Couldn't agree more with that. And it's so inspiring that there's people like you out there on that mission to really be helping people really connect in with that and understand the importance of that. Because I don't know if before I got into some of this stuff, I would have even realized that I was not experiencing that, because I was just so used to being kind of in that other state, and that just became so normal. So sometimes I think we got to have that type of experience to really prove to ourselves that, oh, wow, there is a different way of being and existing that feels a little bit better than the other way.
Yes, I totally agree. Yeah.
Nice. So you mentioned some free resources earlier. I would definitely encourage people to definitely check out your website at paberinstitute.com. Anything in particular that you want to kind of point people to in terms of like learning more about you or your work, or how they can get involved?
Yeah, absolutely. They can go to my website. There's tons of resources on there, but I actually really encourage people to reach out to me. I like to connect with people. So if they send me an email, tell me a little bit about what's going on with them, I can send them resources that are a little bit more directed, that they don't have the time to search all over my website or social media. I can direct them better. And even I do 15-minute free consultations. And so they can email me at amy@paberinstitute.com, PABR Institute.com. So that's AMY@paberinstitute.com.
Oh, that's so great. Yeah. I mean, it's one thing to have that plethora of information and a whole archive and catalog and everything, but then to actually be like, you know what, you should probably get this, this, and this to start off with, could probably make it a lot easier.
Yes, absolutely. And, as I said, I like to connect and meet people, and especially those who are interested in changing their life and their health. It's wonderful to meet people that way.
Yeah. And how long have you been in this field and helping people with this?
I've been in the healthcare field since 2000. Well, I started on that journey, gosh, in 2005, but most recently with developing this process, it's been in the past 7 years. But I've been practicing for over 12 years now.
Cool. So. Just a little side question, just kind of out of curiosity. Noticed not only like in some of your, I've gotten to check out some of your resources and videos and interviews that you've done already, and just noticing the logo as well. I was curious if you had any. I'm curious about the penguin. There's a the penguin logo, and then in the background you've got some beautiful penguin pictures in some of your videos too. So.
Yes. So I'm a photographer as well, nature photographer. Sometimes I do portraits for people, just as a one-off type thing. But I was hired by a world famous photographer to keep him out of a knee replacement surgery and a rotator cuff tear surgery. And so what I do actually helped him stay out of those surgeries. And so I traveled around the world coaching him for about 6 months. And it ended up with me in Antarctica photographing the emperor penguins with him. He was afraid that he wasn't going to be able to walk over sea ice for several miles. And so wanted to make sure he could get there and he's pain-free. So I was able to go to a very remote location in Antarctica called Snow Hill Island and photograph the emperor penguin colony there. And it was truly magical. We were on a Russian icebreaker and had to go through storms across the Drake Passage, and then took a helicopter up in the air for 6 miles to land on sea ice, and then trek across sea ice to this colony. And from there, I took these photos, and they've ended up in a gallery and all these wonderful things since then. So the penguin is my symbol, because it's strength against adversity. It's rebirth. It's all these amazing things and qualities in this beautiful animal that is just trying to exist and have a good life. And so it became my symbol just because of what it stands for. And also what I do got me to this place where I got to meet an animal that had no idea what a human being was. Imagine this 4-foot tall penguin coming up to you and having no fear, no idea, just pure curiosity. And it was truly a remarkable experience.
Yeah, that sounds really, really special.
Yeah, it was. It really was. A once in a lifetime experience. And I tend to jump on those.
So that's a good way to be.
Yeah, absolutely. So, yeah.
Awesome. Well, I really, really appreciate you spending some time with me today, and for letting people know that what you're up to and how they can learn more about it. And I'm pretty excited to see how this kind of percolates not only into my own experience in my life, but I personally teach breathing in my vision work, and I'm just always really eager to find out, what's the best way of doing this, what's the cutting edge, research, and so, yeah, really, really appreciate you sharing this with me and with my listeners today.
Thank you.
Once again, just if people want to learn some more, you can check out Dr. Amy's website, send her an email, and it sounds like she'll be keen on connecting and pointing you in the right direction with this.
Absolutely. Thank you so much for having me on, Nathan. I really appreciate your time, and I feel honored that you gave me the spot to be able to share with your listeners. Thank you so much.
Absolutely. Thank you very much. And for those listening, I'll look forward to checking in with you again next time.